Let's turn now to Kaduna State, where medical authorities have raised alarm over the outbreak of an unknown respiratory tract infection, which they say has now killed 10 children between the age of 3 and 13 years. The outbreak is said to have occurred in Kafancha, a town in the Jamal local government area. The Chief Medical Director, Sir Patrick Ibrahim, Yakowa Memory Hospital, Dr. Isaac Nathaniel, confirmed the incident on Thursday. Well, let's talk to our Kaduna State correspondent who is joining me live for more on these details. On this particular story. Talk to us about what more you have learned as regards this new outbreak.
Yes, good evening, Ifemi. Basically, at the moment, the authorities are still carrying out efforts to identify more cases of people who are now affected by this unknown disease. At the moment, the pathogens responsible for the causes of this respiratory tract disease is yet unknown. But of course, the officials of the Kaduna State government, talking to the chairman of the Jamal local government, they earlier visited the area today to assess the situation. And I can tell you that they have established an isolation center. The isolation center samples have been collected from patients who even died and those who are suspected to have been infected by this respiratory tract infection. And the samples were collected and they're expecting the test results tomorrow. They are also expecting experts from Abuja, but at the moment, the government are issuing a warning to people, calling on them to be very, very careful. Basically, they had reports of a suspected case in a girls' secondary school there in Jama, where a student complained of sore throat and difficulty in breathing and later died. So these are some of the symptoms of this unknown disease. But for now, the pathogen responsible for this disease is yet unknown.
Lupe has live for us in Kaduna. Good to see you, Lupe. Now let's turn to Taraba State, where Governor Agbo Kefas has directed the state Ministries of Information, Agriculture and Health to embark on sensitizing residents on the dangers of contracting the anthrax disease across the 16 local government areas of the state. Health personnel have already been deployed to Cameroon border communities with the state to vaccinate and check those cattle moving into the country. Correspondent to Olabi Adenusi filed this report.
Taraba is known as the largest animal husbandry center in the country. The state, which shares borders with Cameroon Republic, has one of the nation's busiest cattle routes, through which an estimated 5 million cattle pass to other parts of the country monthly. It is why the recent discovery of a case of anthrax in Niger State by the Federal Ministry of Agriculture and Rural Development has Governor Agbo Kefas really worried, considering the number of cattle that moves across the state daily. The governor has now directed the State Ministry of Information and Reorientation to create more awareness on the dangers of the disease through the media.
The reason for this gathering today is to let the Taraba people know, or let them be aware of the outbreak of the anthrax bacteria.
He also wants health and veterinary personnel deployed to Cameroonian border communities. This is already a work in progress, with the State Director of Veterinary Services, Dr. Shehu Abdullahi, confirming that his personnel are out across the 16 local governments of the state, vaccinating cattle and checking livestock coming into the country through the Cameroonian borders.
And we have few of the local governments that is bordering some countries.
When TVC News crew visited abattoirs in Jalingo, the health personnel met on ground spoke on hygienic processing that has been put in place to avoid zoonotic diseases.
All animals that have been slaughtered, we have to survive this before we reach to main market.
Health workers in Taraba State have been charged to be on red alert at all times by checking thoroughly patients that come up with symptoms of the disease.
The outbreak that we are having now, the healthcare workers have to be sensitized so that they will be on the watch out, especially for those people that are working with these animals.
Anthrax is a serious infectious disease caused by a gram-positive bacteria known as malicious anthracis. It occurs naturally in soil and commonly affects domestic and wild animals around the world. Nigeria had its first index case in a farm at Niger State, where some of the animals had symptoms including oozing of blood from their body openings, anus, nose, eyes, and ears.